real gentle. Here we go. Let this side go right up. There you go, beautiful. How'd that feel? You all right?
Uh-huh.
You did great. There we go. Nice. The pain comes from what we call Sharpie fibers, which are nerve endings underneath the periosteum. Going back to your anatomy, here we go. Underneath the periosteum, which is the outer coating of the bone, there are nerve endings. The tendons dive through the periosteum, and as they're being pulled, as they're pulling on the periosteum, because they have roots in the endosteum, they're irritating the Sharpie fibers or these nerve endings inside the bone. That's where that pain comes from.
So in 2005, my porch light was out and I didn't realize it. And I went to go out and there was a stray cat laying on the top step. And when I stepped on the cat, it made me fall and I landed on all 3 of my doorsteps on my tailbone.
Full going down the stairs.
Yes.
Gotcha. Mm-hmm.
And I bruised my tailbone. They gave me a donut. I had to sit on it for like 6 weeks.
Yes.
I've had other injuries. I've hurt my knee twice, my right knee twice. It's got like a little, when I was going through massage school,
Yes.
my instructor told me that it's because of my IT band.
Okay.
Is pulled really tight.
What are you feeling currently? What do you feel?
It's just got I guess it's pulling, so it's made my shin right here a little bit.
So around this bump right here, the
Yeah.
tibial tuberosity?
Mm-hmm.
Okay, so would be the quad. So the quad tendon is what makes up the four muscles here, make up the tendon that attaches here. So it's more the quad. It's a tight quad that's pulling on that. We call that just an attachment there.
Going through school, she told me that I have a little bit of frozen shoulder on my right side.
Okay.
And that's where a lot of my problems have been lately is with my shoulders and my neck. When I was going to my chiropractor up where I'm from, the last time I went, which was around 2010, I can't remember exactly when, but he showed me x-rays where my neck is straight. It's not got the curve anymore.
Gotcha. Mm-hmm.
But I have a lot of lower back.
Yes.
And sometimes it feels like my hips is out of
Okay.
alignment.
Okay.
Like it feels like sometimes they try to give out.
Body's trying to find a position.
Yeah.
Show me your range of motion with that right shoulder. Say it's frozen. How much range of motion can you do? How much can you lift your arm up? Can you lift your arm up from the side? Okay. Does it hurt a lot to do that?
It starts to hurt. And right now I'm actually having a lot of pain in my left scapula.
Kind of up here on the angle here. Uh-huh.
Yeah.
Right here. Okay. And then, but the range of motion, are you saying it compared to your left? Does
It's always, once I lift it up, it
Uh-huh.
starts popping on its own.
Okay. All right. I think it's what happens. What I'm seeing both shoulders is that they're both rounded forward, and when their shoulders are rounded forward, all these cables back here get pulled tight, and that's what makes rotator cuff injury so easily happen. Because think of a rope. If you hold it tight, you can cut it. So the more forward your shoulder is, then you also can pluck the tendons, and that's what you're feeling snap and pop is the tendons rubbing over the bones as you move your shoulder. So it's the alignment, just like you were saying with your x-ray of your neck. Your neck is supposed to have that lordotic curve in it, and for children, taking care of kids, a lot of looking down, and we lose that curve. It's not valued in our world. So there's a couple, not a lot of chiropractors want to go down the path of how do we change it? Well, we have to stretch. In order to stretch, we have to make sure your spine's limber, like clay. We become harder after 26, so we have to go through your spine, limber it up a little bit, and then we can talk about. Did they talk about you said you were at a chiropractor? Did he have a plan for restoring your curve? I'm just curious what they told
He
you.
always used the aviator or agitator, the little machine thing.
Activator?
Yeah.
Got you the clicker.
Yeah. He never adjusted or anything.
No manual.
Yeah. Well, I've actually lost a lot of weight.
Okay.
I used to be actually at my heaviest. I was 267 pounds. I'm down to 165.
Wow.
That's awesome.
Wow, that's awesome.
And so.
Wow. Yeah, that's really hard. I have 4 kids and whew,
That's really
you're awesome. I've had some frozen shoulders where literally people, that's as high as they can raise their arm.
Yeah.
It might be definitely some level of frozen shoulder. It could be, there's definitely, some rigidity that could be in there, and we'll check it out in a second. But, the main thing that I'm seeing just having you, is that this
Yeah.
position, see, it's hard to lift your arm up like that is as far as I can raise my arm if my shoulder's forward. Does that make sense? I have to bring my shoulder back to get my arm up. So if your shoulder is stuck forward, your range of motion is decreased. Your shoulder has to come, watch, if my shoulder's forward, that's as high as I can raise my shoulder if my shoulder's forward. To bring my arm farther back, my shoulder has to come back. And if you can't, does that make sense? If your shoulder won't come back here, you can't have full range of motion. So a lot of the time, because of that forward rotation that we're in, our shoulder gets locked, tight pec, torn ligaments on the back side of the glenohumeral joint, tight ligaments on the front. The shoulder doesn't reset back to center. It stays anterior, and that's what limits your range of motion. Then it can be termed frozen, but it's really the alignment that's causing limited range of motion. Take one deep breath in for me, and then let your jaw relax open, and then just let the air out. Let all the air out. There you go. Keep exhaling. Deep breath in for me. You did great. 2 more. Now let all the air out. Keep going. Keep going. All right, deep breath in. 1 more. Going gentle here. Exhale. All right, stay right there. Stay there. Take a deep breath in for me, and then exhale for me. Exhale and twist. Deep breath in. Exhale. Twist. 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 Good. Good. Very good. Okay. All right, deep breath in. Exhale. There we go. All right, good. It's a little tight there, yeah. Just go face up for me. A little tight. No bones breaking, right? They're just little joints in here. We're just trying to loosen these joints. The upper neck needs to be loosened up a little bit. Real gentle. Here we go. Let this side go right up. There you go. Beautiful. How'd that feel? You all right? You did great. You did great. Yeah, nice.
That was the part that I was worried about the most.
You did great. No, it's not. I'm not trying to move every bone. We're just trying to loosen up the joints that are not injured. The pain that you're experiencing between your shoulder blades is a result of your lower neck being under extra stress. So diverting some stress to your upper neck is the only way to take that stress off. Somebody else has to hold the hot potato. I got your head. Let me hold your head. I got it. There you go. There you go. Very good. You only have a small percentage of your back working, then it's easy for your back to go out in lay terms, right? Oh, my back went out. Well, that's because you only had a small percentage of your back doing a majority of the work. So restoring the curves in your lower back and neck, getting your head back over your shoulders, getting all 24 vertebrae working evenly makes it very difficult for any one area to be injured. If I'm going too hard, let me know. I'm going to keep going deeper and deeper.
It feels good.
All right, good. I like patience. Get it, Ed. All right, I'm learning you. That's like a placement test. I got to figure out what your tolerances are. All right, very good. Oh, she's tough. All right.
Those of us who have had 4 kids.
Yeah, you have to be tough.
And I'm a single mom. I've raised them all on my own.
Wow, you're amazing.
I work 2 jobs right now, so I work 16 hours a day, at least 4 days a week.
Wow.
I'm a teacher aide.
Excellent.
I work with ESE kids, and then I get off and go to a motel and work as the front desk clerk until 11 o'clock at night.
Oh my goodness. Well, that's amazing.
Yeah, right there. We're going to comb that in a second, but this restriction up here is the cause for your lower neck and the shoulder blade. This is the whole cause, and when you go home, this is where you need to direct your daughter or somebody to help you keep this untangled and loose. I mean, how smooth it is on the left relative to the right. I mean, there's a little, wow, I'd almost say virtually nothing. This side might be the side that hurts because the left side is overstressed because you're avoiding the right upper. Does that make sense? So that's why you're having that pain on your left upper scapula, is that you're actually pinching the left lower neck and you're overworking the left lower joints because the right upper part of your neck is being avoided. It's hard to see, but right there, it's underneath, but there's a scar. It healed. The original tissue is very lined up and organized, and when we have injuries, it heals in like a ball of yarn. You call that a scar, and so it's a old injury, whiplash, fall onto the steps going down, even though you landed on your bottom. Now, did they ever say that your coccyx was dislocated? Did they say the tailbone was misaligned, or they just say it was bruised?
No, they just said it was bruised.
Bruised, okay. All right. Yeah, it's a lot of nerve endings in there, a lot of not good. I mean, how quick was that? I mean, that was I barely.
You
And,
have a purple mark after like.
and that was
four
his,
or five swipes.
It's fine.
But you see him saying, I barely even. But that's where you need a cup right there. We got to untangle.
I do. I tried,
Try to get it to stick on there.
and I have the face cups, the ones that like
Uh-huh.
suction,
Good.
and that's what I try to use on my neck.
Yeah, try to get
I
it.
did cup right there.
Good. Yeah, until that's not crunchy.
We used to call that popcorn.
That's right. Yeah, we need that. It needs to be evicted.
Now I have jade washes and I have a plastic washer. I've been
Mhm.
trying to find the spoon, the like little ceramic spoon,
There's not much over here. Yeah, go ahead.
but I can't find one.
It's more about the how you use it than the item. I've used a jar.
Yeah, I know.
I'm so bad. I've used a Smucker's jar lid. I mean, it's. We try to be technical with it, but it's really.
They used to make fun of me in class because I would carry my guasha in my back in my pocket on my scrubs.
It's how it's used, not the tools. That makes sense. It's
Yeah.
the application, not the.
Yeah.
I've used literally anything.
But during clinicals,
Mhm.
and I would always have mine. And when they go, they're like, Dawn probably has hers, so they come to me, and I'd be like, "Yep, right here in my pocket."
You got to get that rib down. I know. Yeah, I know it's tender. You got to get that down, like there.
Mm.
I know. We'll get that face down in a second. I'm gonna try to adjust you a little bit deeper. I've already loosened it up. Here we go. I got you. Let me have the head. Let me have it. Yeah, a little piece there. Very good. Chin up. There you go. All right. Let me know if I'm going too easy or too hard. I'm gonna keep going deeper and deeper. All right. Beautiful. You're in heaven, huh? This is what you needed. Whew. I can see the scapula right there is supraspinatus. The more forward your shoulder goes, the more this muscle gets tormented. Okay. Mhm. Try to let it go, sink into the table, let your shoulders go, relax. The thoracolumbar junction, I know. It's a transition zone here that tends to get tight, diaphragm attachment, lat, traps, quadratus lumborum. And this tightness here is what's keeping your middle back rigid, the lower back overstresses. Right, I know.
That's pulling on my shoulder.
All right. It's a good stretch for your shoulder. I know it's tough. The frozen shoulder would give you a lot of discomfort. This is the glenohumeral joint in here, and that's where the crystals would be.
It was hurting when you had it pulled back.
Just moving your shoulder back, right. And that's what I'm trying to say. Your range of motion is because your arm won't retract back. And that's what's limiting your range of motion. So you have frozen shoulder, but it's because there's an inability of your shoulder to round back. I'm not- Right in here, all of that has to be cleaned up so that your shoulder will come back easily.
Now, do you would adjust your wife, Dr. Ed?
All the time. Yeah, it's a
Yes.
bonus. In between the shoulder blades really is a referral.
Mm.
Yeah, right there, I know. We can almost knock out two birds with one stone with the roller. So when we first start with a foam roller, and when you're pressing in here, laying on your back, at the same time you're going to be stretching your arms to the side, eventually above your head, and you can work on pushing this in, which allows the head to come back, and at the same time you can work on getting your shoulders back.
And I actually have a foam roller.
Beautiful.
I would use it to try to pop my back,
Yes.
but I can always pop part of it, but like
Right.
right around my shoulder blades, that area.
It's too tight.
just-
Yeah. There we go. Yeah, we'll check out that quad in a minute. I want to.
I can tell you there's like
Yeah.
gonna be some knots
Okay, we'll
like
get down
right
there.
in
Yep,
there.
Let's get it. Get down in a second. Little breaths. You're doing great. Uh-huh. Good. You're doing great. A little bit decreased on the right. See the difference? Your left comes farther down. There's definitely a little bit. You see that, Crown? Your left arm comes back farther. Can you feel it's almost closer to the table? And this is elevated. There's about an inch or two of frozen shoulder on the right.
I've actually I've cupped right there too.
Good.
Before.
Good. The pec and the front part of the shoulder all has to be lovely.
It's been a while since I've cupped it though. And I cut down my arm too. Like my upper arms.
That cable there has to lengthen a little bit. The muscle has to lengthen.
Mm.
It was coming out right there a little bit.
Mhm.
Too much? Too much? Too okay?
Mm-mm. That's good.
Okay. Much better. Yeah, you got that much lower. And the idea is to actually hold this for about 20 minutes. Now, you're not going to be able to do that for first time, maybe 2 minutes, 1 minute. Does that make sense? And you work your way up to 20 minutes. It takes time to, your hands might go numb. If that happens, go to the side. You want to work all these angles. Okay? So you work noon. Does that make sense?
Yeah.
11 and 1, 10 and 2, 9 and 3, clock. Work all those angles. It's like, what do you want? How do you describe that? It's like, kind of grainy feeling.
Yeah, I feel it.
I want to compare that to your left in a second. I think there's an injury up here, maybe from that fall. That
Well, I've injured this knee twice. When I was in 4th grade, someone ran over it with roller skates. He was skating backwards and he knocked me down and ran over it. And I
Wow.
had a full leg cast. It was bruised from about here to about here, the whole
But do
way.
you feel the difference? There's no graininess, very little
Yeah.
graininess on this left side.
I can feel the difference.
Because this is all knotted up, now you're trying to straighten your leg, it's pulling on that inflamed attachment because of the constant stress that's on that attachment to begin with. That's more than it should be.
Yeah.
We need to lengthen. This is where you need cups right here. We need to. That can't feel like that. That's got to be
So I need
over
to
time. Correct. Right here.
Right there.
Right on. I mean, feel almost like it's. There we go. That's good.
It's like bubble wrap.
Yeah, that's got to be. There's an injury in there that needs to be lengthened. The attachment can be pressed down on. I wouldn't do any transfriction over that attachment. You're just, if you want to do anything to help this pain, you ice it or Epsom salt or just compress. Okay, I don't do any transfriction or like I'm doing. I wouldn't do any gua sha on this right here. I would just hold. You want to, I think of it like Panera bread. You want to panini this attachment down.
Okay.
The pain comes from what we call Sharpie fibers, which are nerve endings underneath the periosteum. Going back to your anatomy, here we go. Underneath the periosteum, which is the outer coating of the bone, there are nerve endings. The tendons dive through the periosteum, and as they're being pulled, as they're pulling on the periosteum, because they have roots in the endosteum, they're irritating the Sharpie fibers or these nerve endings inside the bone. That's where that pain comes from. So you want to press the periosteum back down into the endosteum. That's what's lifting off. The tendon's actually lifting off. Eventually it'll cause what we call an avulsion, right? An avulsion fracture. The bone will actually separate and crack if you keep. Now, this attachment is lifted off because it's been avulsed and then it filled in, and then it avulsed and filled in. That's why you have a raised up attachment here, because of years of the tendon pulling up the bone like a mountain, and then the dirt fills it in.
Yeah.
But this attachment's inflamed. You want to just press like that, hold, pressure. How's that feel? A little sore? Good, okay?
Yeah, it's a little sore.
A little sore. Yeah, you want to just, I would don't need transfriction, just hold that down. Okay? Good, yeah, just press that and panini that attachment back down. But all of this won't work if we don't lengthen that scar in the quad. We have to lengthen that to give the cable some slack so it's not constantly pulling on this attachment. Okay.
Oh, yeah.
Yeah.
I figured it'd be that.
We got to get all that. That's what you're feeling back there that's inflamed. The alignment is what keeps that constant pulling in there. So we'll show you in a second. We're going to start stretching and try to get some. We're going to start up here and work our way down. Let me see your shoulder. Go ahead and move that shoulder around. See how it feels now. A little bit more range of motion.
It's popping too.
Yeah, it just takes time to stretch and lengthen all those cables.
Just pop.
Let me see the other one. Compare that to the other one. Just the right one's clicking.
Yeah.
Yeah. This tightness we got to keep working on, getting that leveled out. I would do 20 minutes. I call it 20-minute sessions. You have to. You understand this? I mean, my shoulder even. If you listen.
Yeah.
It's not abnormal to have a little bit of things moving around. There's tendons, there's cables, and there's bones moving. What I want is symmetry. I want your left to be like your right. I don't want one shoulder more forward than the other. Pretty obvious when you laid on your back, one arm was, back, and the other arm couldn't come back as far. Eventually, the main things that get expensive are the labrum, which is the edge of the cartilage in your shoulder, and the rotator cuff get injured because the shoulder's forward. So it's more imperative that we get your shoulders back for the health of those tissue. There we go. I gotcha. Tilt your head a little bit to the right for me. There we go. Yeah, nice. There we go. Tilt your head a little bit to the right. There we go.
It's kind of weird.
Left. All right, no. What is that? Let's see. Tilt your head to the left. What's an ear seat? What is that?
It's kind of like acupuncture.
Okay.
But it's seeds, so you're not piercing the skin.
Okay, try to go back. There we go. Does that make sense? I don't need to overwhelm you, but we want to push your edge a little bit. Does that make sense?
Mm-hmm.
Go ahead and try to roll and drag your bottom and move upwards. There you go. Is that too much pain? All right. You want to push yourself, but we need to do time also. So time is more important than depth. The first goal is to get to 20 minutes. Then we can worry about the depth, okay?
I lay like this for 20 minutes.
I know. That's what it takes to stretch your posture. Everything I do on the table will make this easier, okay? So I know it seems insurmountable, and maybe the first few times you only do 2 minutes. You're saying you're not going to start at 20 minutes. The goal is eventually 20 minutes. My point would be that if it's too uncomfortable, make it easier so that you can get to 20 minutes. And then once you're able to get to 20 minutes, then you worry about the depth. There you go.
Like
Inside.
that.
There you go.
And I'll
Up.
stretch that.
Correct. That's how you want to lengthen that quad. Do that instead of 10 times. 10 times, stretch, hold, and then you'll need to do some cupping or gua sha to lengthen that scar in there from that
Okay.
injury, and that'll help take the stress. And then you want to, like I said, pin any of that attachment down. Very good. Thank you so much.
All right.
Thank
Very
you.
good. Thank you.